Good morning, everybody, and welcome to our United Way coffee chat. These are short meetings where we are going to give you a brief overview of one of our in-house programs, share the results and the impact of that program, and give you a little more insight into how you can advocate for our community to get help these programs actually provide. And hopefully you'll leave this meeting feeling really great about your investment in United Way and will have a smile on your face because you know you helped our community. My name is Janine Joy, and I'm the president and CEO of United Way. And I am very fortunate to sit in the position that I do because I get to work with a ton of great people who are completely dedicated to helping our community, and they just deeply care in general. And so with that, I would like to introduce Keisha Wick. She's a manager in our 211 department, as well as Linda Hafner we have on the call, who's the vice president of 211. Good morning, ladies, and why don't you share a little more about United Way 211?
Good morning. Today I'm going to give you an overview of our program, highlight a few of our community partnerships, as well as share some examples and success stories. United Way 211 is a comprehensive community helpline. It's a 3-digit number that anyone can access for information on health and social services. When someone calls 211, they connect with a community resource specialist. The community resource specialist provides active listening to understand the caller's needs, conducts an assessment to determine need, as well as what other resources the caller may be in need of, as well as connects the caller with the resources capable of meeting that need. 211 is a national program. We are accredited by AIRS, which stands for Alliance of Information and Referral Service. They oversee our operating standards. Staff can train and test for professional certifications. Several of our team members are certified and or are working towards their certification for community resource specialists. We also have a staff member who's a certified community resource specialist database curator. Our United Way 211 serves Lee, Hendry, Glades counties. Our services are available 24 hours, 7 days a week, 365 days a year. We partner with ACT, Abuse Counseling and Treatment. ACT handles our after-hour, weekend, and holiday calls. In 2020, we handled a total call volume of 80,545, which represents a 32% increase from 2019.
I'm just going to jump in here real quick because we have a couple people who just joined us.
Okay.
Welcome to Coffee Chat. Today we're talking about United Way 211, which is our information referral line for health and human services. Kind of always reminds me of Ghostbusters when I think of it. Who are you going to call? You know, when you need help, when someone you know needs help with health and human services, you just simply dial 211, or we also have a regular 9-digit number. 9 digits? We have a regular number. It feels like a Monday. And that's 239-433-3900. And Keisha was just sharing that last year, over 80,000 calls were taken by our United Way 211 staff. And Keisha, sorry if I messed up your groove here, but I'm going to turn it back over to you.
It's okay. Thank you. Some of our top 5 needs included electric payment assistance, rent payment assistance, COVID-19 testing, tax preparation, and food pantries. We follow up with all of the callers who were provided referrals within 10 days to determine if the resources were helpful and to see if they may need additional resources. We have several community partners. Emergency Operations Center, we partner with our local Emergency Operations Center to assist handling calls in times of need such as hurricanes and COVID-19. During Hurricane Irma, we received over 42,000 calls. Around 3 and 4 o'clock in the morning, We received calls due to the storm surge where folks were reporting that water was coming into their homes. To our surprise, calls were coming in from the Lehigh Acres, Buckingham area. We were able to report that to the EOC that flooding was occurring in those areas. COVID-19, we also actually did receive a call from a client inquiring if they could bring their alpaca.
So in times of the storms, when United Way 211 is activated, we get calls on everything from whether can I bring my pet alpaca with me to the shelter, to where are the closest shelters to me? Do I need to evacuate? Am I in a flood zone? You'd be surprised at how many people don't really know what zone they live in. So, we always share with everyone, right, Keisha, to make sure you get that hurricane guide every year, because it has all that great information in it that you can quickly get to know what your zone is and know if you have to be evacuated. Go ahead, Keisha.
During COVID-19, we handled thousands of calls regarding COVID testing, vaccinations, and financial assistance, such as the Emergency Rental Assistance Program. Help Me Grow is a partnership with Healthy Start, as well as a state contract with the Children's Forum. We screen all of our callers to determine if they have children in the household ages 0 to 8, and if so, if they have any developmental or behavioral concerns. If they do, we connect them with the Healthy Start Care Coordinator to provide a further assessment and referrals for specialized programs. Lee Community Healthcare and the Health Planning Council. We have 3 staff that are liaisons and provide resources to the patients of the 3 clinics that are located in Dunbar, Cape Coral, North Fort Myers, and the GME residency program. These clinics offer adult primary care and chronic disease management, including asthma, COPD, congestive heart failure, and diabetes. We also have 3 healthcare navigators who will help patients navigate and enroll in the Affordable Health Care Act. Vita, we assist the Vita program, Volunteer Income Tax Assistance, through the Volunteer Center by serving as an entry point to educate, screen for eligibility, and schedule appointments for tax preparation. We assisted with over 5,300 calls. I'd also like to share some stories and examples. On Tuesday, we received a call from a mother calling on behalf of her daughter. Her daughter was a single mom with 7 children with very little food and fluids in their household. They were not able to go anywhere due to COVID diagnosis and lack of transportation. We contacted a local food pantry who happened to be closed but were preparing for their food distribution the following day. We explained the situation and they put together several bags of food and fluids, which we were able to pick up and deliver to the family. At the beginning of COVID, one of our partner agency friendship centers was amazing, and they were helping us get food to families in needs, seniors who had over 60.
Yes. Sorry, I'm going to jump in here real quick. Again, I just keep jumping in this morning. Sorry, everybody. We've had a couple more people join us again. And so I want to make sure that we are covering everything here on people who know how they can call. So, for example, let's say that I have a loved one that, and I have an aging parent, and I think they may be going through dementia. And I'm wondering what's going to happen. Is that something I would call 211 for?
Absolutely. We would connect callers with our local area agency on aging, Elder Helpline, as well as our partner agency, the Alvin A. Dubin Alzheimer's Resource Center.
And so if somebody calls and they have a need, let's say a caller calls in and says, I don't think I can make my electric payment this month. My family was out of work for 2 weeks due to COVID. And that electric bill is due tomorrow. And I think they're going to turn off my electric. What kind of resources are available for somebody like that?
There's actually quite a few. We have eHeap, which is for those who have a member in the household who are 60 and older, through friendship centers. Lee County Department of Human and Veteran Services has LIHEAP, Low Income Home Energy Assistance Program. We also have programs in the area for programs such as Power to Share, which is for LCEC customers, Care to Share for FP&L customers. Also St. Vincent de Paul.
So it sounds like there are a lot of resources out there in the community, but it's not one size fits all, right? Sometimes there's criteria for each one. Like the first one you mentioned, you had to be 60 or older, I think you said.
Yes.
So 211, what you're doing when you call 211 is you're getting that expertise from our information and referral specialists, because they know the ins and outs of these programs with the database that they have. And so it's kind of like, I always like to think of it as if you're looking for a certain part for your refrigerator and you open the yellow pages and there are, 100 places you could go to, and you don't want to call all 100 because they're not going to have what you need. Instead, with Health and Human Services, you call 211 and they're going to guide you to the one that will hopefully best suit your current situation. And so it's really helpful in the fact that somebody like Keisha answers the phone and says, what kind of assistance are you needing? What's the situation? Do you have a veteran in your home? Do you have an elderly person in your home? Do you have a child with disabilities? That kind of guides people, right, Keisha, to different avenues of different services.
Yes. There's also another partner agency of ours, Cancer Alliance for Naples, for those who are undergoing cancer treatment.
And so, with United Way 211, I think what we want everybody to walk away from today with is that if you know anybody at all who's in need of health and human services, whether it's for them or for a loved one within their family, they should pick up the phone, they should call 211 and get connected with the services that will help them most. And Keisha, do you want to share a couple more stories?
Yes. We also received a call from a client contacting 211 looking for resources. In the conversation, the client disclosed that she was embarrassed that her 13-year-old grandson, JJ, had gone to school with the same backpack he had used last year. We discovered she was the 74-year-old taking care of her grandson because the child, her daughter, had passed away. She became emotional as she also shared that her husband, a U.S. veteran, had also passed away, causing a financial hardship. We connected Grandma to the school social worker for clothing for the child through the Community Impact School Resource Program, which is another department within our organization. We had also received a few backpacks from Community Impact, and we knew we could make a difference. Within an hour, we had coordinated the backpack, school supplies, and a gift card to be delivered. We recruited our president, Janine Joy, to make the delivery. Grandma had shared that with Janine that JJ had a younger brother, and unfortunately, she wasn't able to take them both in. She also expressed her concerns of whom would take care of JJ if something were to happen to her, and mentioned of a need of home repairs. We provided additional follow-up to provide resources to the agencies in the community, and will continue to work with her. She was very grateful that we made a difference in her and her grandson's life. We also have a small pot of money to help individuals and families from falling through the cracks. Just wanted to share a few stories. Recently, we received a call from another department in our organization, We Care. They were working with a young man who was undergoing cancer treatment, tongue cancer. He was in need of a medical equipment, a suction device for his mouth. No programs were able to meet his needs. We were able to assist with purchasing the device to ensure proper medical care. We also recently assisted a Lee Health employee through our Employee Resource Assistance Program who had been out of work due to COVID-19 diagnosis. We were able to assist her with her electric and water bills. She thanked us for being the bright light in these dark times.
And so United Way 211 also works with some of our companies, organizations within the community, like Lee Health, Lee BOCC, as well as a couple others in providing assistance within their organization to their employees. They identify themselves as an employee of that organization, and we're able to work with them on the situation that they may have. But we'll help anyone at any time. Public Supermarkets also is a generous sponsor of United Way 211, helping when these instances happen where people may fall between the cracks because, there's just not a service out there that is able to help them at that time. We get calls night and day, obviously, 24/7, right, Keisha? And, it can be anything, but some of you might wonder, let's say you're talking to your relative who happens to live in New York, and they're explaining how they've fallen on hard times or they need help with something specific in Health and Human Services. Keisha, is it as simple as dialing 211 no matter where you are in the nation?
Yes, and you can also go to 211.org to find the 211 that services the area that they're looking for.
And one of the things that we've noticed, especially during the pandemic, is people are asking for help for the very first time. And it's really hard when you've never been in a situation where you need assistance. And so we like to point people also to our website, right, Keisha, because it's as simple as going to unitedwaylee.org. We're going to show that to you here. I'm going to share my screen here.
You can search from the privacy of your home or office.
So you just click on the Get Help tab here. And then what are they looking at here, Keisha?
Under the search area, can I have you type in emergency food? And just for an example, let's say you're looking for a food pantry in Lehigh Acres. Janine, can I have you type in the zip code of 33972?
72, okay.
Okay.
And then hit search.
Yes.
There we go.
So we come up with Lehigh Community Services, which is the Lehigh United Way House. We have Faith Lutheran Church, New Life Assembly Food Pantry. And Janine, may I have you click on Lehigh Community Services, please? Okay. Here you can see their hours of operation. And this location also offers an access site where folks can apply for food stamps.
So it's a really easy way to kind of search for that help, and it gets people a little more comfortable with possibly eventually picking up the phone then to speak to one of our information and referral specialists. But this is available for anyone in the area, and you'll even see it pulls up this nice map here. You can make a PDF of the search results. So if you're maybe the HR person in your company and somebody says, hey, I really need help with this, you could search this, make a PDF of it, print it out, and hand it right to them so they can walk away with resources.
You can also change what language it's printed in as well.
So right now we're going to open it up for questions. Does anybody have a question about United Way 211, what they cover, or how to get help? All right, Linda. Linda Hafner, again, is our Vice President of 211, and she's been with the 211 department since we started it years ago. Linda, did you have anything you wanted to share with everyone?
Well, I appreciate Keisha's overview. She did an amazing job of the service that we provide, but just a reminder of what you mentioned earlier, Janine, that, you know, if you happen to know of anyone in need, whether that be a neighbor, a relative, a coworker, a lot of folks out there have really fallen on hard times with this pandemic that we are all experiencing. And I think we all know someone that may be in need. And if they are, just remind them that it's as simple as picking up the phone and dialing 211. And again, our trained community resource specialists will assess their situation and then point them in the right direction of where they can find the services that they need.
And so many times if someone calls and they say, I need help because, you know, my electric is past due and we don't have the money to whatever, there's usually something else going on, right, Linda? So it's more than just a simple exchange of information, correct?
Absolutely. When that caller calls, they may be thinking that they just need food for that after, you know, they may be thinking, okay, I just need food. Where do I get the food pantry? But if we take some time and we really assess that situation and dig a little deeper, we might discover that they've had their hours reduced at work, or they might need employment, or they have a loved one in their home that's sick and they need some additional healthcare services. So we tried to do a comprehensive assessment so that in the end, we've actually connected that caller to many different services and resources. And then, as Keisha mentioned in the earlier part of this program, that 10 days later, we will follow up with that individual or that family and find out if those resources worked out for them and why or why not. That not only allows us to make sure that we are connecting them to the appropriate resource, but it also lets us as 211 continually find out about changes within our resources in the community, because oftentimes programs run out of funding, they have eligibility criteria that changes. It is a constant update of resources. And especially now during COVID, when testing sites are changing and vaccine opportunities are changing, and our resource department stays extremely busy every single day.
And when the vaccine was coming out, I remember actually everyone in our United Way organization got on the phone to help answer calls because everyone wanted to know how they could get a vaccine. And I think we had, you know, in the last week of December and the first week of January, 20,000 calls hit the platform. It was just unbelievable because everybody wanted that information as quickly as they could get it.
Absolutely. Historically, that was our highest call volume in the history of our program.
Yeah, it was pretty amazing. So Linda, you were mentioning the resources and being up to date and everything. And sometimes a call, we may not get all of the information on a caller on a certain situation. And Keisha, you can jump in on this too. So if somebody goes to a resource and it didn't help them, or they say they're not eligible, would you suggest that person give up? Would you suggest that person gets back on the phone and calls back? What's the best way for somebody to handle that? Because there are going to be times when somebody can't get the assistance at one of the referrals.
It's important that they call us back so we can explore other options.
And a lot of times you'll find out something else. Maybe it's a piece of information that they didn't share with you. And, you know, it's sad that sometimes in order for people to get help, even if they've fallen on hard times, maybe they had a great job leading up to being out of work for 2 weeks, but they were living paycheck to paycheck. If there's a salary qualification, they may well exceed the annual income. And that's why a lot of times people do fall through the cracks. They need temporary assistance. And, you know, nobody should have to, you know, be totally down and out before they get the help that they need. Anybody else have a question? All right, so next.
This is Gene.
Yes. Mm-hmm.
Well, first of all, I want to say you guys do a wonderful job because you give us as tax preparers a resource, because when we're sitting face to face with people, they need more help than just their taxes. And now that I know you guys exist, we've got somebody to call. I guess my question for Keisha and Linda, if I wanted to come spend a half day with your crew just to get more up close and personal, can I do that?
Yes, you. Oh, go ahead. Who was? Janine, were you jumping in? No, I'm sorry. I thought I heard somebody jump in. Yes, well, Jean, we would love to share more details about what we do provide. However, we are a very confidential program. And so due to our confidentiality guidelines, it would be difficult to possibly have you listen in on calls, but we could definitely spend some more time giving you a little bit better understanding, if you wanted to, of the different resources that we do provide and how we help our callers.
Okay.
And Jean,
Nice.
that's great that you've made the connection and how we can help more of our Vita clients when they're coming through. And thank you for being a volunteer. We greatly appreciate it. And that is one of the things that United Way 211, we're not just a service that we've stood up on our own. That accreditation we go through is actually one of the criteria, is the confidentiality. And a lot of times it does help that person pick up the phone because they know it is going to be a confidential call. So it's very helpful in getting people to open up and ask for help in circumstances that they may not normally do it. And so next week, we are actually going to be doing a coffee chat on our Mission United program, which is a program within United Way 211, and it deals with veterans and active service members. You will be surprised next week when you find out how many veterans and active service members we have in our area and the kind of comprehensive help that United Way 211 is offering through our Mission United program. So if I'm going to leave you with anything today, and I've been doing these on all of our coffee chats, even ones where it wasn't a 211 topic, if you know of anyone who needs assistance, please have them reach out to our United Way 211 program by simply dialing 211 or 239-433-3900. They will be connected to a very caring, as you saw today, information and referral specialist. They will have a comprehensive assessment done, and they will point them to the programs and the services in our community that are most likely to help them. So please, please, please be our advocates out there in the community and make sure you share the message that help is only 3 digits away. Just dial 211. Thank you for your time this morning, and thank you for joining us for our coffee chat.